Well, hi everybody, this is Dr. Schroeder with this week's video introduction to week number 7 of our course in professional nursing practice and nursing theories. And boy, what a great week of discussion. I went maybe about 24, maybe 36 hours without really checking into class. When I came back in, it's like, oh my, as a class, you really know how to take off the discussion and how to bring in so much, just a wealth of information. I'm just really impressed with everybody's contribution. I don't think there was anybody in class this week that didn't have a very substantive uh, contribution to the class. Roger, great job including the graphics. Susan and Amy, excellent information. Um, Margot, the conversation between you and Susan and the way that you were just both feeding off of each other in a good way and really bringing in new information and getting everybody, I can just feel kind of the excitement. And that's really neat. When I, as an instructor, don't have to come in and do a lot of sparking. It was, boy, it was just really sort of taking off. So I'm really impressed with the discussion that went on this week. Of course, the topic this week was talking about the different nurse practice acts and how well, ostensibly, really, the primary, kind of what started the discussion going was how advanced practice nursing is defined in each of the states. And as we discovered, and as you all discovered and reported, it's all over the map. Some states are very specific as to who is an advanced practice nurse and how a nurse practitioner is defined differently from say, like a family nurse practitioner and a general nurse practitioner, where other states don't really address it at all. New York in particular is one that always surprises me. There's almost always a New York nurse in class who always says, it's not really addressed in New York, which is really interesting when you look at the New York um, state board compared with Connecticut or with Oregon or with California or some of the other states. It's just really kind of amazing to me that as a nursing profession we do have such a varied set of standards as to what an advanced practice nurse is. I don't know that I really have a answer, except that it kind of does bring up the question: does there need to be like a real national standard, or does having the patchwork quilt of different standards varying by state to state, meeting individual state needs, is that really adequate? The bottom line is that nursing practice is defined by the states. This is a states' rights issue. Uh, RNs are licensed by the state, and even though there are a consistent set of standards across the state lines, really when it comes to these kind of specific definitions as to what an advanced practice nurse is not consistent. One topic that came up in class that I will address here, I didn't really address it in the discussion threads, but I will just do it here in the video, is the question as to why isn't a nurse educator considered an advanced practice nurse? As a nurse educator myself, that's one that I kind of asked frequently. I am not an advanced practice nurse. I am a doctorate, but my doctorate's in education. My doctorate is in curriculum, focusing and specializing in curriculum and instruction. And as a doctorate level nurse, I have completed research, and I am a research nurse, and that's kind of one of my areas of expertise, but I'm not advanced practice. And the one consistent thing with advanced practice is that it is truly, it has to be at a practice level. And nursing education is really kind of sort of getting into a different kind of a profession. That's why it has a different doctorate if you become a doctor of nursing education, or excuse me, a doctor of education. Most nurse educators that I know are currently either going for a PhD if they want to do research or doing a DNP. And either one of those will definitely solidify you as an advanced practice nurse. The clinical nurse leader track. This is a relatively new advanced practice track that is, I was at a conference last year where Gene Watson and Sister Callista Roy presented. And it was brought up that the clinical nurse leader is more and more becoming, especially in the East Coast, really viewed as a true nursing leadership track, taking over in many ways the old clinical nurse specialist role in the hospital. So those of you that are on a CNL track, you have a good future ahead of you. And just again, I want to commend the class on the great contribution that everybody made, and the discussions and the sharing of information. I am just very, very happy. It has been a pleasure to be with all of you in class, just to enjoy the level of discussion. And like I say, it's always nice as an educator when the class leads a discussion and does it very well. And my role is one to just answer questions and come in and lead the discussion. This is one that everybody just really took off, and I really appreciate that. Excellent, excellent job. This week, in week number 7, we're coming down towards the close of the class, just a couple weeks to go. One thing I'll say right off the start, and I'll put this in when I post this, I'll post it as well. Please note that I have changed the day. The week 7 assignment, your cultural change project, that's going to be due on Sunday night, not on Friday night. So you do have through the weekend to complete that if you need to. As I said, everything that's a submitted assignment is going to be due on Sunday. You have through the weekend always to do that, so just that includes this particular assignment as well. So hopefully that is good news for most of you, unless you like to procrastinate, but I don't think that most of you really are that is something that you have to worry about too much. But to talk a little bit about the Cultural Assessment Project, this is a slideshow presentation. It's not a paper. But if you reflect back on the feedback that I gave you on your group presentations, remember, should always have an introduction, should always have a conclusion. Those are, and think of terms of what would you be presenting to the class. And you may, if you want, it's always nice, I think, if you record audio. It is possible to go ahead and record audio and actually do an audio presentation, or if you put in the speaker's notes the information that you would be relaying for your presentation. The goal here is you're going to be talking about you're going to identify a cultural group, and I posted a message in class or answered a question about what does that mean necessarily. Usually when we think of a cultural group, we're thinking in terms of ethnicity or nationality, but that's just one way to define culture. I'm a mental health nurse, and personally I view the persistently mentally ill in particular, as a cultural group. They have their own language, they have their own set of challenges. They even have their own legal system in most states, or at least legal challenges that they have. So they very much fit the definition of a culture. And so that's just one example. The homeless culture is another commonly used culture. It is perfectly fine to use for you to identify a cultural group. A cultural group is really just a population that shares values, beliefs, mores, and as discussed in the reading this week. So if you have any questions about the particular group that you're looking at doing this cultural change project, or talking about this change project, please go ahead and let me know. Remember, this is not an assignment that you're actually going to be following through with. All that you're really going to be doing here is proposing what would you do, and then discuss how would you implement this particular project. What would you do? How would you assess it? How would you know that you're successful? And again, that's the basic idea and the basic task at hand for this particular assignment for week number 7. And then you have a discussion question. As always, the initial response due on Wednesday, the follow-ups due by Sunday. And the discussion question this week kind of goes back to week before last. We started talking a little bit about social values and social obligations. And we're going to talk about it now more specifically about what are the social responsibilities of a nurse, and what are the, how do nurses meet the needs of populations, meet the needs of individuals. And so we're going to talk a little bit more about social obligations and social justice in nursing with this discussion question. So as always, I encourage you all to continue your fine work. Don't get burnt out. Just remember, you can go ahead and participate minimally. You know the criteria by now. Don't feel like you have to necessarily respond to everybody's responses to you. But I do encourage the lively and encourage the ongoing interaction. It has been very nice and excellent, and I am happy that it seems like everybody is really getting that spark that this class is really all about. Many of you are really starting to see, I think, the opportunities that lie in front of you as either a clinical nurse leader, as an advanced practice nurse. Some of you are interested in global nursing issues, others the issues are closer to home. So I look forward to continuing on exploring that and discussing all these different things. So as always, let me know if there's any questions. Keep up the excellent work. We just got one more week after this one, and we'll see you in the discussion forums.